This study is an contrast enhanced CT scan of the abdomen in a patient who presented in the emergency room with right lower quadrant. So they're obviously concerned about appendicitis. Just kind of scrolling down, this is the spleen, which looks normal. Pancreas is here in the midline. This is the confluence of the superior mesenteric vein here and the splenic vein. Spleen sits right on top of the splenic vein, and that looks normal. We've kind of gone up and down through the liver, but the liver also looks normal. Normal adrenal glands, the abdominal aorta is normal in caliber. The kidneys appear normal. There's no hydronephrosis, particularly in the right kidney. No retroperitoneal lymphadenopathy, so we're now down in the right lower quadrant where the patient's hurting. Do see a mildly enlarged lymph node right there, catches my eye. And so the next thing I want to do is I want to find the appendix. This is the terminal ileum. I can tell that's going into the cecum. I can tell that it's the terminal ileum because there's a little bit of fat in the ileocecal valve. And if I follow that out, that's clearly small bowel. So the appendix should be coming off the cecum inferior to the terminal ileum, and then there it is. There's the appendix. And so how we determine if the patient has appendicitis, we want to see two things. We want to see an enlarged appendix. This looks like a very big appendix. I can kind of magnify it up here, and I'll just do a measurement. 8 millimeters is kind of a cutoff for normal, and this measures 10 millimeters. And then the second thing we want to see is some signs of inflammation. And I'm going to pull up the coronal, because I think in this case we see the inflammation a little better on the coronal. You can clearly see that there are these linear areas of higher attenuation in the fat. Some of it's a little more amorphous right here, but clearly different attenuation than the normal fat that we can see here in the central abdomen. So that is some periappendiceal inflammatory change. So we got an enlarged, inflamed appendix, and we can be real confident that that is acute appendicitis. I'll go back to the axials, but we don't see any evidence of free intraperitoneal air. I would check these at lung windows, which I want. I do not see any free fluid now that I've gotten down through the pelvis. Sorry, lost a little bit. And I don't see any fluid collection, so I don't see a periappendiceal abscess. The other pertinent thing to notice is that appendix, the wall is enhancing, the wall is continuous. If this was a necrotic appendix, it would not be enhancing. It might see some extraluminal air, which I don't see. Seeing a perforated appendix obviously alerts the surgeon that this is going to be more than just a routine appendectomy. But this looks like just simple, uncomplicated appendicitis.